detailed comparison, Friedreich's ataxia versus Ataxia-Telangiectasia. Genetics and molecular pathogenesis. Friedreich's ataxia FA, gene FXN, chromosome 9. Mutation, GAA trinucleotide repeat expansion in intron 1. Protein affected, frataxin, a mitochondrial protein. Pathogenesis, reduced frataxin, mitochondrial iron accumulation, oxidative damage, degeneration of spinocerebellar tracts, DRG, corticospinal tracts, and heart. Ataxia-Telangiectasia 8 gene, ATM, chromosome 11. Mutation, usually frameshift or nonsense, ATM kinase loss. Protein affected ATM, key for DNA double-strand break repair. Pathogenesis, defective DNA repair, chromosomal instability, immunodeficiency plus cancer susceptibility. Progressive cerebellar Purkinje cell loss. Number 2, inheritance. Both are autosomal recessive, but their clinical implications differ. FA families often show sibling clustering. AT often suspected when a child has recurrent infections, neurological decline. Number 3, age of onset. FA, onset 5 to 15 years, late childhood, early teens. Becomes wheelchair dependent by 20s. 8, onset 1 to 4 years, early childhood. Walking delayed or progressively unsteady by age 2 to 3. Number 4, neurological features. FA, spinocerebellar sensory ataxia, progressive gait and limb ataxia, loss of vibration and proprioception, posterior column degeneration, areflexia in lower limbs. Positive Babinski due to corticospinal tract involvement. Dysarthria develops later. AT, pure cerebellar ataxia plus ocular motor problems, severe truncal and gait ataxia, cerebellar degeneration. Oculomotor apraxia, child has trouble initiating eye movements. Mild neuropathy, but sensory loss is minimal. Intention tremor, dysarthria. Number 5, eye findings. FA, nystagmus may occur, no telangiectasia. AT, pathognomonic, conjunctival telangiectasias, dilated blood vessels, 3-6 years old. Oculomotor apraxia, cannot quickly look toward stimuli. Number 6, musculoskeletal features. FA, scoliosis, very common, pes cavus and hammer toes, leg weakness and wasting. AT, mild hypotonia, but orthopedic deformities less prominent. Number 7, systemic involvement. Cardiac features. FA, up to 60 to 90% have hypertrophic cardiomyopathy, arrhythmias, CHF. AT, heart usually normal. Immune system. FA, normal immune function. AT, combined immunodeficiency. IgA, IgG subclasses. Recurrent sinopulmonary infections, bronchiectasis common. Endocrine metabolic. FA, diabetes mellitus or glucose intolerance common. AT, endocrine normal, growth may be delayed. 8, respiratory problems. FA, restrictive lung disease due to scoliosis, aspiration risk and late disease. AT, recurrent infections due to immunodeficiency, chronic lung disease, major cause of death. Number 9, cancer risk. FA, mild or no increased cancer risk. AT, very high risk, non-Hodgkin lymphoma, acute lymphoblastic leukemia, leukemias due to DNA repair failure. Number 10, laboratory findings. FA, genetic testing confirms GAA expansion, normal AFP, normal immunoglobulins. AT, elevated fetoprotein AF hallmark, low immunoglobulin levels, increased chromosomal breaks in karyotype, increased radiation sensitivity. Number 11, MRI findings. FA, spinal cord atrophy, thinning, mild cerebellar atrophy late. AT, pronounced cerebellar atrophy, especially vermis, no spinal cord thinning. Number 12, progression, a steady, slowly progressive over decades, wheelchair by 10 to 15 years after onset. AT, faster progression, loss of ambulation by early teens. 13, life expectancy. Death often in 30s to 50s, cardiomyopathy most common. At death often in teens, 20s, infections or cancer. Number 14, treatment approaches. FA, supportive PT, O-care, cardiac and diabetes management, trials, antioxidants, iron chelators, gene therapy approaches, immunoglobulin replacement therapy, treat infections aggressively, avoid radiation exposure, extreme sensitivity, cancer surveillance. Number 15, key distinguishing features. Super high yield. Feature, Friedreich's ataxia, Ataxia-Telangiectasia. Classic sign, cardiomyopathy plus scoliosis. Telangiectasia, immunodeficiency. Onset 10 to 15 years, 1 to 4 years. Reflexes, areflexia, hyporeflexia. Sensory loss, marked, minimal, normal, high. Cancer risk, normal, slightly, very high. Immune status, normal, immunodeficient. Eye sign, nystagmus oculomotor apraxia plus telangiectasia. If you want, I can also generate a table comparing 30 plus parameters, Mnemonics to memory. Thank you. Have a nice day.